Hey everybody, welcome back. This is going to be Microbiology 2. We're going to start with the respiratory pathogens. So there are the natural defenses that the pathogens have to penetrate before infecting the body, and that involves the hair, the cilia, and the mucus as the physical defenses, wall dyers, tonsillar ring. Remember, it's the adenoid, palatine, and lingual tonsils, all in the nasopharynx area. And on top of all of that, we have the normal flora that is in the respiratory tract along with the GI. And those are going to help with the secretions of lysozymes, secretory IgA, lactoferrin, mucus, and then of course there's the cellular defenses that involve the alveolar macrophages. So the pathogens avoid being consumed by the macrophages by bacterial adherence to like the epithelial cells, secretion of the extracellular toxins in order to keep the immune cells at bay, or intracellular growth to protect themselves from the other like leukocytes coming in. They also have the capsules or the slime layers in order to avoid phagocytosis by the macrophages, and they also make the IgA proteases. So the IgA is going to signal the antibodies to come and signal the other immune cells to come and defend the body to consume or destroy the pathogen. So these proteases are going to degrade the IgA, so there's not going to be any signal alerting the immune system. Okay, so the syndromes are going to be like very widespread. That's why it's called syndromes, not just a disease. So upper respiratory tract infections include like all of this. It's not just a cold. It also involves sinusitis, otitis media, the rhinocerebral mucormycosis, and the lower respiratory tract infection. There's going to be the whooping cough, pneumonias, tuberculosis, and then the only ones that really involve both upper respiratory tract and the lower respiratory tract is the croup disease, and it starts like the name says in the larynx, so laryngeal bronchitis. The most common causes of the respiratory tract infections are actually viruses, but bacteria, fungi, parasites, and worms can also cause them. Of course, the bacterial infections are the most serious. They are very, very hard to treat. Okay, so the cold viruses would be your rhinoviruses, the coronavirus, the adenovirus, and the influenza virus. The cold bacteria are going to be the Chlamydophila pneumoniae and the Mycoplasma pneumonia. Sinusitis and otitis media can be caused by either the viruses or the bacteria. And the bacteria are going to be your strep pneumoniae, H. influenzae, M. catarrhalis, and Pseudomonas aeruginosa. We'll go through all of that later. Pharyngitis is generally caused by adenovirus, then the Coxsackie virus, Epstein-Barr virus, herpes virus, and then strep pyogenes. The rhinocerebral mucormycosis are going to be caused by the Rhizopus species or the mucor species. The epiglottitis can unfortunately spread from the epiglottis into like the trachea, so this is kind of the ones that you really need to be watching out for. So H. influenza, strep pyogenes, strep pneumonia, Staphylococcus aureus. Diphtheria, whooping cough, and croup are also other rare diseases now in the States because we do have vaccinations, but if they do cause disease, it's pretty serious. Bronchitis is mostly caused by the respiratory syncytial virus, but it's also caused by all sorts of other viruses and bacteria. Okay, so pneumonia is going to be split into two. The typical pneumonia, which involves consolidation of pus in the lungs, along with the flu-like symptoms, and the atypical pneumonia, which are going to be more mild symptoms, so they're cold-like. Typical pneumonias are going to be caused by your strep pneumoniae, Staphylococcus aureus, Pseudomonas aeruginosa, the Burkholderia cepacia, Klebsiella pneumoniae, and the Acinetobacter baumannii. Atypical pneumonia are the ones that you really gotta watch out for because these can last for like months and months and months. And they can, of course, progress to like ARDS. So pneumonia is always pretty serious, but atypical pneumonia is insidious. It's caused by the Mycoplasma pneumoniae, the Chlamydophila pneumoniae, and Legionella pneumophila. The regional is going to be caused by certain fungi or bacteria that's really specific to a certain region. Occupational are going to be and the ones involved with, animals in particular, so zookeepers, ranchers, really. And the opportunistic are, of course, these are flora that's naturally in our body, but if you have HIV/AIDS and your immune system is down, these can, of course, come in and cause problems. Okay, so starting with the common cold, we all know how it is. The differentiation between a cold and a flu is usually the fever. The complications are really more involved in children, where the immune system is still developing, so once it's down, it can predispose the child to the bacterial sinusitis and the bacterial otitis media. And the most common cause is rhinovirus. Pharyngitis is a bit more serious. It involves, of course, the sore throat, dysphagia because of the sore throat, postnasal drip, but it's more characterized by these enlarged cervical lymph nodes and the exudates on the tonsils. Usually, it's caused by the adenovirus and the Streptococcus pyogenes. The Strep pyogenes infection is much more common in children. Adults are generally caused by the virus. This is problematic because if it's untreated, it can lead to acute rheumatic heart fever, and that can damage the mitral valve and cause mitral insufficiency later in life, or mitral stenosis, and that can cause a murmur. Murmurs are always bad, or not always, but it's generally bad news. Because it can lead to arrhythmia, and of course arrhythmia can lead to a whole host of other complications. So as a physician, you really, really want to be careful and make sure that this isn't strep pyogenes. Sinusitis and otitis media generally follow wisdom tooth extractions, generally in younger adults, so gotta be careful. They follow viral infections as well, and they're really characterized by the bulging of the eardrum. Look how erythematous it is. Generally, it's caused by strep pneumoniae. So remember before with the pharyngitis, that's strep pyogeny. So this is strep pneumoniae. Everybody's had this at least once. We do treat this with droplets. So a bit tricky in children. Okay, croup. Croup is thankfully rare here in the States, but we still need to watch out for them. So it affects the entire respiratory tract and is caused by the parainfluenza virus. It is an opportunistic kind of infection that follows an upper respiratory tract infection. So after like strep pneumoniae, parainfluenza virus comes in. It's characterized by this kind of costal retraction, that's what it's called, on breathing. Is a wheezing sound, it's a barking cough, inspiratory stridor. Okay, words, right? So it's like a whistling sound when the child like breathes in, and then they cough very, very, very hard after. So it's going to be like a but more of a whistling sound, and then followed by a for like an extended period of time, and then they do it all over again. So the symptoms worsen when they're laying down, and there is something called a Steeple Sign on the x-ray thanks to the trachea inflammation. So listen to it on YouTube. It's a very distinctive kind of cough. So bronchitis generally occurs after the upper respiratory tract infection, and it's going to be spread to the bronchial tree. There is a fever, productive cough, sore throat. It's usually caused by a respiratory syncytial virus, and it's a self-limiting disease, so you just treat the symptoms. Pneumonia is going to be accumulation of the fluid. It's called consolidation, and it's the infection of the alveoli and the parenchyma of the lungs. So the signs, you want to feel the chest wall because you want to determine the phragmitis or phragmitis. I'm not sure how to pronounce that. And that's going to be the vibration of the chest wall. You can put your hands on your own chest and feel the normal vibration, and it's going to be a lot. It's going to be a lot like duller, like less vibration if there's excess air in the lungs or increased thickness of the chest wall. So you also percuss it. You want a hollow sound. That's going to be normal, and it's going to sound dull if there is, fluid in the lungs. There are different sites of pneumonia. It can be in the lobar or the broncho pneumonia or the interstitial. So when you listen to a person with, consolidation, there's going to be increased vocal phragmitis, increased transmission, but pleural effusion. So there's going to be, fluid in the pleura, not in the lungs, in the pleura. There's going to be decreased vocal phragmitis. So important to keep those apart. Okay, so typical or acute pneumonia is rapid onset. It's really common in the hospital. One day they're okay, next day they have very, very high fever, shaking, chills, and a productive cough. There's going to be, of course, the dense consolidation on the x-ray. So x-ray is actually like first line. It's going to be the first line go-to for like diagnostics. Like you don't really culture this stuff. You just get an x-ray. It's cheaper and faster. The atypical pneumonia is also known as walking pneumonia, and you just feel kind of sick for a long, long time, and sometimes there isn't even patchy consolidation. The lungs look normal. You want to watch out for younger adults, so college-age students, young men in the military who lives in barracks and stuff. Then they have like unexplained weight loss, low-grade fever, and it lasts for months. Okay, that's it for now. Thank you for your attention, and good luck studying.